Hi, it's Dr. Melanie ND, and I just wanted to share the number one thing that I talk to clients, patients, and colleagues about, and that is please don't assume that you have low stomach acid. This is something my goodness, I probably talk about multiple times in a week at least. And the reason being is that it's very common. So many people, if you go to a health food store, you go to a nutritionist, to many different practitioners, especially if they're treating in gut health, and that happens to be an area of my expertise, irritable bowel syndrome and small intestine bacterial overgrowth. And because I was also trained to consider this to keep low stomach acid in mind, I, of course, have used this in my practice as well. But also, it was a comment that another colleague made related to SIBO, actually, and gut motility, because the stomach is the first phase of this movement called the migrating motor complex. So it was something I wanted to take a look at and say, okay, do we really need to increase the stomach acid or do we not need to? Is that not a factor? So for a number of years, I have been ordering a test called a Heidelberg pH test. And you can go to phcapsule.com for more information on that. But what it is a radio frequency capsule about the size of a supplement, actually, tied to a string that then needs to be attached to your face, and then you swallow it, and it's going to measure the amount of acid and the acid production in the stomach. So I've tested over 100 stomachs. I'm just going to give you some statistics here. And only 5 people have had, technically, we call it hidden low stomach acid. And what we mean by hidden is that when the capsule actually lands into the stomach, it's not that there's not enough stomach acid. That's actually extremely rare. It's an autoimmune condition. Trust me, you do not want to have, it's very serious. I've only seen or had to work something up in that direction one time in almost 10 years of practice. The more common thing is to have what's called hidden hypochlorhydria. So what that means is that when the capsule's in the stomach, it's taking those stomach acid cells longer, more often longer than 20 minutes, to re-acidify the stomach or even reach a level of a pH that enables the stomach to empty properly. So when we don't have adequate stomach acid, or if we have too much stomach acid, our contents in our stomach, whether it's food, medication, supplements, they're not going to be digested properly. So a really good example that I think of that I learned a lot from myself was a nutritionist who came to see me taking over 30 supplements, and betaine HCl just happened to be one of those supplements, but was taking up to about, I believe, 9 capsules per meal. Okay. And I asked them to please just pause this. This is one of the things that I like to do to kind of give the stomach a rest. And then we did this particular test, the Heidelberg pH test. And lo and behold, it turns out that their stomach acid cells were fast to respond and produce more stomach acid, or what we call hyperchlorhydria. And just they needed just the opposite. And the next step that we also take is we want to look at the cells, the stomach acid cells, and because there can be an autoimmune reasoning for why they're either over or under producing stomach acid. But this was a perfect example of somebody who was even educated themselves, trained, certified nutritionists. And the reason why I bring this up is because we did further blood work. And it turned out that they had even another particular blood marker called gastrin that was also elevated. And this is something that kind of, takes the serious up a bit more. And just in the fact that this person was extremely grateful that they had done the time out of taking the betaine HCl, got this information. Not only that, found out they were doing the exact opposite of what they should be doing. but they also got better and felt better really quickly, because that's something that I hear often is that, and there was even me. I just started taking betaine HCl, thought it was the best thing ever. And that's pretty common. People think, oh, this is it. And then there's like this plateau, or if not, maybe they don't even realize it, but they actually feel worse. So sometimes it is actually nice to take a break, especially take a break from taking so many capsules. And so that's just one of the things that I share with all of my colleagues, anybody who treats gut health, especially treats SIBO, is I just say, please, please, please do not assume that you have low stomach acid. And of course, if I can be any help to you directly, you can reach me at intuitiveedgedoctor.com.